You're listening to the Good Question Podcast with Richard Jacobs. Our goal is to make each of our guests exclaim, that's a good question. I don't know the answer. Because when that happens, it means you, the listener, may be inspired to learn more beyond the interview and to ask great questions yourself that lead to new insights. In this podcast, we cover historical and current anthropology, comparative religion, and history. Welcome, and let's get started.
Hello, this is Richard Jacobs with the Good Question Podcast. My guest today is Dr. Hany Demian. He's the founder and CEO of Praesentia Healthcare. We're going to talk about PRP, platelet-rich plasma, and peptides used as biotherapeutic. Dr. Demian is a regenerative medicine pioneer. He's also CEO of BioSpine, which is one of North America's most advanced spine and recovery centers. He was a former trauma doctor and a pain specialist, and now he's integrating stem cell science, AI diagnostics, and genetics to a new personalized medicine. And he speaks globally in healing, innovation, and purpose-driven healthcare. So welcome, Hany. Thank you for coming.
Thanks, Richard, for your time, and thanks for inviting me. It's a pleasure.
Yeah. Well, tell me about your current clinic. What are some of the services you all offer? And then we'll go deep into PRP.
Sure. So right now we provide traditional pain management, which entails radiofrequency ablation, epidurals, nerve blocks, and whatnot. And on the other end, we do a cutting-edge spine surgery. So minimally and microinvasive endoscopic through 5mm incision. We do laminectomies, discs, fusions, spinal canals, stenosis, injuries. Most of the spine surgeries that we perform there are day surgeries. In the middle, we try to fill the gaps using PRP, stem cells, exosomes, and the power of the body to start healing. We've started that a few years back, but the progress has been enormous, and happy to share with you and with the listeners.
Okay, so we'll start with PRP, but we'll go into other stuff. So what is it, and what situations medically would you use it in?
So PRP is not new. PRP is used for years. We used it for years. In fact, if we look into history, it started years ago in the ancient Egyptian. They used to do something called blood patch. So when they get injured in the field, in the farm, at war, they used to do mini cuts, get the blood to ooze there, and they put plants on it, lotus plant in specific, and let it heal. Wrap it and let it heal for a few days. So the idea is the same. We take the blood, we spin it from the patient himself or herself. We spin it to get rid of most of the cells, and we'll keep only the plasma and the platelets. Why the plasma and the platelets? Because this is a concentrated dose of platelets. Platelets has a lot of healing, growth factors, as well as bioactive proteins. Those proteins, when you direct them towards an injury, whether it's a tear or arthritis or a tendon injury or whatnot, they specifically work on this area. So they're circulating in the body, but you're directing their attention and putting a high concentrated dose towards that injury. They go in and they activate other cells around them. Those cells are like fibroblasts, chondrocytes, all the cells that actually form the tendons and the ligaments and the bones and the cartilage, and they go in and activate them in the high numbers, right? And do this few times, you will reduce pain, you will reduce inflammation, and you will have the environment active for healing. They wouldn't form new cells. They wouldn't form new tissues or organs like people think, but they will make the environment ready for that. That being said, I've seen it. I've been using it for almost 10 years now, and I've seen the progress. It's just enormous. From the first PRP cells that we were able to isolate 10 years ago, they were like tens of thousands. Now we're isolating billions of cells.
Right. So why does a platelet-rich plasma help healing? I mean, I guess could you say like platelets are there to close off wounds? Wouldn't they just close off blood flow to an area instead of heal it? Like why does this work?
Not at all. So the way it works is, unfortunately, ligaments, tendons, and any injured area, they usually lack blood supply. So tendons they don't have the best blood supply, and healing them takes a long time. With aging, that actually takes 10 times longer, right? So you're bringing them the food and the nutrients and the proteins that they need to heal. If they're not coming through blood and you're forcing them from outside, you're forcing them to heal. You're forcing the cells to go into this area. So you basically, if the supplies are cut because there's no blood supply due to an injury or a poor supply in this area, you're delivering it, feeding this area specifically with platelets. And why platelets? Because platelets form, when you have a cut or a laceration and whatnot, and you start having a crust on it or a scab, right? This is exactly what platelet does, form a network that other cells can walk on it. So it's like a railway where the other cells can actually be delivered on it. This is what platelets does. Without it,
they set up like a scaffolding for the delivery of other healing elements.
Exactly. And funny, if we think on the other way, we give other patients blood thinners, so like aspirin and whatnot, and this aspirin make the platelets function stops. So that's why they have blood thinning, right? So they interfere with the platelet function and they stop it from clotting, and that's why you have blood thinners. We give this to heart patients and patients with a lot of blood clots formation and whatnot. So that's usually stops the platelets from doing its job. Now we need them to do the job, and we're actually focusing their attention to the injured area, and that's how it works.
Well, if you look at it, if I'm looking at an injured area and there's an inlet and an outlet, and I'm looking at this from a flow perspective, and all of a sudden a huge bolus of platelets comes in, would they be limited in leaving the site and temporarily kind of get caught in there and cause swelling and aggravation? Because why would a tendon not have good blood flow? Is it because the inlet is very narrow? Or is it because the outlet is very narrow? Again, from a flow perspective, what's the limiting area in a wounded area that prevents enough blood flow from getting to it?
Exactly. You described exactly the action that we're hoping to activate. We put it in there. They try to fix as much as they can, but some of them, if you're putting a billion cell that are compressed in a 5 cc fluid in a joint, some of those cells will do the job, some will die, cause inflammation. This inflammation will create inflammatory reaction that will clean the injured area. So they will clean the dead tissues, they will clean the dying ends of the ligaments and whatnot, and have a new formed blood supply. And then all the inflammatory mediators will come and clean this area in your body. That's why after PRP, it feels like somebody punched you really hard in the joint or the tendon. So the pain gets worse. For the first few days where all this inflammation happens, we need this inflammation. This inflammation actually accelerate the formation of collagen. That's why the aesthetic friends and doctors use it for vampire facelift. So it causes a lot of inflammation, but this inflammation accelerates and increases the formation of collagen cells, which forms muscle and muscle fibers and whatnot. So you're absolutely right. We do this. Some of them will work, some of them will die, cause inflammation, swelling, but after that, the body will absorb that and the healing process. This process usually takes a month. So what do you describe in few seconds? That actually takes a month. The first few nights are very hard on the patient. It's kind of painful. Then after that, the patient feels much better, stronger, and the healing process starts.
But I guess during the initial few days, you should not take aspirin or NSAIDs or anything, because what about NSAIDs like Advil instead of aspirin? Still,
yeah, no, we usually advise even before that, Richard. We usually 5 days before, 5 days after. We actually to the point that we tell the patient don't drink, because drinking alcohol will actually inhibit the platelets activity. Aspirin, any anti-inflammatory, steroids are usually pretty strict. Not even antibiotics. If the patient is on antibiotic, I wouldn't do it. If the patient is sick, I wouldn't do it, because we don't want to overwhelm the tissues. They're fighting for a viral or bacterial infection. I don't need that. The patient doesn't need that. And what about contrast baths, icing, and heating? I've heard that drives circulation. Heating the areas. Yeah, heating will be absolutely better. Absolutely better. Heating, resting as much as you can, fluids as much as you can. I ask the patient to increase supplements, collagen supplements, for a few days before and a few days after. There are specific supplements that we advise the patient to take, like bromelain, omega-3s and stuff like that will increase the blood flow and increase the function of the platelets.
Okay, that makes sense. So what about very light exercise or walking, or is that discouraged till the first few days are done?
It depends on the on the injured area. If it's shoulders or whatnot, the patient can exercise, but not really on that shoulder. So you can do legs, you can do cardio, whatnot, but otherwise just try to rest it.
Okay. So the person will experience, like, again, soreness, maybe more pain, inflammation for a few days, and it'll turn, the worm will turn, and then all of a sudden they'll feel better, stronger. I can agree.
Yeah, and I've used that personally several times. I was an unbeliever, Richard, until I torn the abdominal muscle, right? I told my abdominal muscles I was at gym and I was doing setup, I think I was weights, and I heard something like as if your jeans are ripping.
You were benching 800 pounds again. It just didn't work this time. Right.
Yeah, I wish it was that glamorous, but it's not now. So yeah, and the next day I couldn't even get out of bed. It was that bad. I went to the clinic, and one of the docs put the ultrasound, and he found a few holes in my abs, and he said, yeah, that probably will need surgery, but why don't we try PRP? I did it once every 2 weeks for 8 times. And after that, I was able to go back to the gym with no problem whatsoever. Never had a problem since. So I said, this stuff must be working. So I started offering to the patients. And with the progress of PRP, right now we're offering PRP, PRF, exosomes, peptides, and just IC.
I'll get to the other stuff. I just had one more question about PRP, if you don't mind.
Yeah.
Are you injecting from a circulation sense? Are you injecting right before the wound site so that most of it won't be lost and it'll go into the wounded area? And then I guess some will probably slip by and become circulating in the blood.
Yeah, we've got 2 ways to inject. That's really good question. Really good question. So we've tried over the years, and I think our protocol is, number one, if it's a small area, we usually flood it with 4 or 5 cc. If it's a bigger area, I inject before and after. So if there is a tendon and there's an inch separation or whatnot, or a big gap, I inject before and after, trying to mitigate that risk and to increase the flow at the ends of the injured tendon or a ligament, so it will start growing or whatnot. There is no point of injecting right into the gap. The cells wouldn't bridge and would probably end up dying, causing more inflammation than healing. But yeah, that's absolutely a great question.
What about I would think a lot of people have hidden damage to their microvasculature, their whole body. So what happens systemically, for the extra stuff that gets by the wound site? Does it affect, do people have the hidden sore spots? Oh, I didn't realize my elbow, and I guess my elbow had damage, and some of it leaked into there, in a good way. Do people experience that, like systemically, other things are affected because now of the circulating nature of the PRP?
Yeah. So I'll tell you one of the cases that we worked on, and it was just quite significant. We did PRP. It was his adductor muscles in his leg, and we put significant amount. We kept pushing almost more than 8 cc because the gap was big and he was insisting, right? That patient had heart problems, had ejection fraction, right? Ejection fraction of 15. Right? After we did this 3 times, he went to his cardiologist and his ejection fraction was 635. So it's almost doubled, right? Because we were pouring it literally in that injury like as he wanted, hoping that something would happen, maybe better pain relief, but some of it went to the heart and the patient, and we've got all the records for that, and we're hoping to be able to do another case study and publish it. But yeah, you're absolutely right. Some clinics will do PRP IV infusion. Haven't seen a lot of success from that yet, but it's done, and it's done in a lot of South America, like Mexico and Panama and whatnot, but I haven't seen a lot of success from that.
Well, what if you did the week before, you did a preliminary low dose infusion to fix any, small holes around the body, and then you do your targeted dose right before and after the wound site, because now all that would be used more effectively, and when it circulates back around, it would continue to hit that site, because the other sites have been, more or less filled up by any extra PRP.
That's a great idea. We've been doing similar, not the same, with exosome. But for PRP, because it's a very limited amount, we're trying really to focus on that. And there hasn't been a lot of studies doing that, but this is a great idea. I wouldn't mind trying it myself. I have a lot of injuries from sports over the years, and I've been thinking about having an infusion of that nature for a while.
Yeah, if you do like a low dose to be safe, it's a systemic cleaning, or systemic repair that you could do, once every 6 months, once a year. I wonder if a protocol like that over time would be really helpful.
It definitely worth the look into it. I'm not sure why it hasn't been done yet, but I'll dive into the literature, and if it is, I will definitely look into it for myself. I've been trying a few things recently, and it's been great.
Hey, let's go into some of the other stuff. So exosomes, I studied about them a bit. I know that cells produce these extracellular vesicles, these little fluid and DNA and RNA filled vesicles that that use in cell-to-cell communication. So you all are able to isolate exosomes and then inject them back in. Is that what you're doing?
We've been doing a couple of things. We've been doing human injected or human extracted. So it's an endogenous exosome. So we take the blood the same way. We do the same process like PRP, and we've got the first machine in North America that can, with phototherapy, activate your internal endogenous exosomes. And we've been using that with a great success. It's been a privilege. We've used it now for the past 6 months, and it's just unbelievable. It hurts way more than PRP. As you can imagine, I tried it myself, and the pain was more than 3 days, almost a week. But the results are just unbelievable. We're looking in
kind of exosomes are you trying to activate? Which cell types are
all types. It has almost 1 billion. No, sorry, more than that. It almost have 4 billion per mil of fluid, and we pack those into a 6 cc and we inject them. And we've done infusion for those, and the results are just unbelievable. I think we need.
You'll take a sample and then shine light on the sample to beef up the exosome production, or you just shine the light on the body?
No, on the body, no, on the exosomes itself. On the exosomes.
So let's say you're culturing them, essentially you shine the light, the cells produce a lot more, the density increases massively, then you inject it.
You are absolutely correct, yes. So those are the endogenous. That what we've been trying to do, and we've done it in special cases. We've done almost 50 patients so far, is the exogenous ones. All what you hear about the mesenchymal cells from umbilical cord, we've done those almost more than 50 times, right? And for some reason, we're not getting the same results as the endogenous one. The exogenous ones are great. The science are behind it, but it could be the way that's stored. I don't believe that we're getting or yielding the same results that we're getting from your own and doing it in the same time.
It might be because in the production of exosomes, remember they use the cell-to-cell communication. So there's going to be some like authentication factors that say, are you part of me or are you a foreign cell? Yes, I'm the same, I have the same MHC on the outside of my cell, let's say. It's all right, I'll let you in and I'll let you function. But I guess I know I'm anthropomorphizing, but that's probably why, because the exosomes would have very different ride-along compounds and the body would recognize them as probably more foreign than endogenous ones. And so maybe wouldn't allow certain functions,
I would absolutely agree. And I have patients that when I had it done in Panama, in Mexico, and came back very sick with autoimmune conditions. So we're very, very cautious about it. We look at our sources. They have to be FDA approved or Health Canada approved. We don't do anything that's not approved. So we know that they went through scrutiny. So yeah, I think you are correct. I think we are not used, or we still not able to introduce foreign cells to our system yet. And I think our system will fight, especially if you're healthy, especially if you're younger. Your body was going to fight it.
Has anyone tried to access, exogenous ones, but within a family? Are there any factors that have been identified? Like you transfuse blood or an organ. Are there any common factors that, it's hard to analyze exosomes, I'm sure, but if they could find factors that identify them as uniquely for a person, and perhaps in a family, you could do exogenous exosomes, like a kidney transplant for your brother or something,
That would be amazing. We stored our kids, our 2 boys, stem cells when they were born, umbilical cord. And I was thinking about that recently to take some cells and inject it on my torn rotator cuff, right? So I'm in contact with the company, but it hasn't been done yet. I don't think people got to that point of having to get exosomes from umbilical cord from a family member. I don't think it's done yet, but I don't see a reason why not. I think will be much better. And like we've seen, what's his name, Brian Johnson, the guy who never dies. Well, he took son's blood, right? And he injected him and he used it different ways. I think why not doing that instead of mesenchymal cells not knowing where they're coming from?
I know that's interesting, but I'm glad he's not my father.
I'm telling you, he's done weird stuff. Some of it you never know. It might be science fiction now, but it might be true later on.
So why would you use exosomes instead of PRP? Like what kind of wounds or conditions would work better with exosomes versus PRP?
PRP, even with the new PRP activated billion cells, exosomes are much more. They have multi-billion cells. So you are impacting a huge punch towards an injury. That's number one. Number two, they are more stronger as messenger cells. So they really put this area on fire, make every cell work to the maximum. Plus, the new study showed that they work on the cellular level as well, while PRP work on the outside of the cell. They work on the cellular level and they are connecting with the mitochondria inside the cell to make them produce what it needs to be done. So peptides and exosomes right now are the only two mechanisms that we can communicate directly with the mitochondria inside the cell.
Does anything, if you apply exosomes because of such tremendous activity and upregulation, do any compounds get depleted? Do you need to follow up with some other substance that'll again take away this depletion so the body can go back to functioning normally quicker?
No, they haven't seen any negative feedback or downward regulation or anything else. It just, my concern as always, Richard, it's just what if the patient has cancer? You know what I mean? I'm always wary about that. I'm always advise my patients to do genetic testing, but I've seen exosomes now and it's very, very commonly done, especially after therapeutic plasma exchange. They go in and they exchange their plasma and whatnot, right? They usually infuse exosome, right? An infusion over an hour. What if I have cancer? What if I have a hidden cancer? What if I have, the disposition for a cancer? That's my concern. Would it increase? I had a patient that came with spine pain years ago, and he insisted on having PRP. So we did x-rays and whatnot, and the patient, it looked like degenerative disc disease. So I injected PRP 3 times. Pain wasn't going away. I sent him for an MRI, and sure enough, he's got spine cancer, right? So, and then less than years ago, I spoke with his oncologist. I spoke with his radiation oncologist after that. I said, what do you think the PRP would increase that? And the notion was, it's not going to help. It might not increase that cancer or help spreading it, but it definitely wouldn't help. So I stopped doing it in cancer patient altogether. And right now, it's one of the contraindications for PRP. The patient has cancer. It might regrow the cancer back.
Well, also from doing interviews, they said tumors do produce a very different profile of exosomes, and they believe that metastases or metastatic sites will communicate their exosomes with the main tumor. So I could see if you upregulate exosomes, like you cancers, ones that come along and instruct sites to repattern themselves for metastases and everything. So it's probably a bad idea.
It is a bad idea. And I was in Dubai recently, and most of the conferences I've been to recently, they think that anti-aging regenerative will progress significantly in the Middle East. They have lighter regulation. But anyways, I was there visiting 6 clinics, trying different treatments and whatnot, and nobody asked me if I have cancer or not. Nobody. You want therapeutic plasma exchange? Sure. Pay here, get it done. You want exosomes? Sure. Pay here, get it done. You know what I mean? But you never know. I wouldn't trust having it myself without having genetic testing. And I did my genetic testing before doing any kind of a treatment. So that, I think, a downside for the rush into exosomes and PRP. I think patients should be a little bit more cautious about that. But otherwise, exosomes, fantastic.
But where are they cultured from, by the way? Is it just blood?
No.
Or what kind of cell types?
Cord cells, umbilical cord cells, mesenchymal cells.
Oh, the endogenous ones, though.
Oh, the endogenous are blood.
Has anyone tried to do a cell biopsy from a given organ and then culture it from there? Let's say the liver.
Not at all.
I just wonder if anyone's, if you cultured again from the liver some hepatocytes and then stimulated them to produce exosomes and injected them back in. I just wonder what would happen to the condition of the liver, for example?
Not at all, but there are trials now trying to fix liver cirrhosis with infusions of exosomes. So there are multiple big studies now and looking into this. I haven't seen any positive results yet. But yeah, they're trying to fix liver, the kidney disease with exosomes. For me, it will be something to look forward to. I have a lot of patients that will need that, but I don't think the external one will work, like you said, without cell mapping and seeing if the cells are compatible with ours. I think it will be quite difficult.
Guys. All right, so we talked a bit about PRP, exosomes. You also provide peptides, which I guess are short segments of proteins. And what else do you provide?
Yeah. So I just attended a course by Dr. Seeds in Orlando. He's one of the really pioneers. We call him the godfather of peptides in Orlando a couple of weeks ago. I can't wrap my head how much peptide developed in the past few years. I can't wrap my head. It started few years back when all the fitness influencers were promoting MK677, which is a growth hormone releasing peptide. And it was just a gym supplement for people who cannot get their hands on human growth hormone. So it goes in, it pushes the pituitary to release growth hormone, right? So it does to a certain extent, but the hunger that comes with it was not worth it at the time. So I tried it for 90 days. I just couldn't stop eating. So I said, yeah, it's not worth it, right? A few years later, you hear about BPC, body protective compound 157 and TB500 from the Liver King, right? Because he was doing a lot of stuff and whatnot.
Oh, yeah.
Yeah. One of his remedies, I guess, was BPC and TB, promoted by Andrew Huberman after that, and Joe Rogan. It went like fire, right? For gym, recovery, healing, right? And people start experimenting with it. And sure enough, I tried it. It works very well. And I've been on it since then. So actually, this year, they are treating chronic conditions with it. It's as if we are creating an alternative medicine towards next to our Western medicine, you know what I mean, with cholesterol pills and diabetes and whatever. They are treating MS, ALS, and muscle and scar tissue and this and you name it. They were treating cardiovascular conditions. They're treating head injury, concussion, trauma. And I believe that this is just the start.
What is it? You said you've been doing it for years. What has it done for you?
So 5 years ago, probably right at the start of COVID, I wasn't recovering well from the gym. I wasn't. I work out a push day and I'm struggling for a week to recover. Tried every gym supplement, every gym pre and post workout, did not work. So I said, you know what? Let me look into something. And then one day I was, can't remember, in the kitchen and I cut myself. And this cut stayed probably 3 or 4 weeks. I said, getting old really sucks. So I said, I usually recover faster than this few days and I'm good to go. So let me look into this. And this is when I looked for BPC and TB. I started with BPC and within 90 days, recovery is unbelievable. I can do a push day to failure. I can go back within 24 hours, do another push day, and beat my numbers the day before. Just unbelievable. I have a lot of horse injuries. Pain is gone. The morning stiffness, gone. The stiffness in the fingers from doing procedures, gone. So I added TB and things got even better because TB works a little bit different and increased angiogenesis, so increase the blood flow. When I have a cut in my finger now, I think within 24 hours, no bleeding, nothing, it start to heal, looks amazing, and in a few days, I don't even see it.
You should start telling your patients that you're 300 years old and they're really doing this.
Immortal. Yeah. So recently, I said, you know what, let me try with few of the lighter peptides, right? I'm on the conservative side, but I like to try it myself before prescribing. So I tried GHK and I noticed the skin. My wife, after 2 or 3 weeks, we were sitting having dinner. I said, what did you do your face? Why? Your skin looks different, way younger. So GHK, copper, skin and hair, I would say improvement 15 to 20%, right? Just unbelievable. I tried recently GLP-1, so I tried Mounjaro, other than the weight loss and whatnot, but the inflammation is just remarkable. The visceral fat went down significantly, and I'm looking to have a DEXA scan soon. Added to that something called tesamorelin, which they are raving about it in that conference. So I started 2 weeks ago, and I'm more leaner. energy increased by like 30%. Sleep is much better, much better. I look at my Whoop wearable and the sleep is much better. It just, I can't tell you, like those peptides work. They work.
You said GLP-1 though, Onjuro, quick question. You took it for weight loss, but you noticed other positive effects, or like what happened? Your inflammation went down?
Yeah, inflammation went down, and better than that, the visceral fat. I was always, you know what I mean? Because my eating schedule is always tied up to either kids or clinic, right? So you end up bloated, you know what I mean? And you eat a little bit late, a little bit early. You don't eat, you crunch all your meals in one meal. So like I'm trying as much as I can to be functional and healthy, but work is work, right? But bloating is gone. Visceral fat is gone. Like we're talking noticeable, right? Not like, yeah, have you been losing weight? No. Like week to week. And I'm documenting all this by picture with my personal trainer. And hopefully after 6 weeks, I will post them all. It just, it's quite a transformation. I never liked Ozempic. I never liked Saxenda. I wasn't really, I would prescribe it for the patient if they really need it, but I would really into them. But this dual action is just unbelievable.
Okay. Well, very cool. We have a lot more we can still talk about, but we're at the top of the hour. What's the best way of future though?
Is the future, Richard. I think peptide will be the future. From what I've seen in the recent conference, it's just an alternate world of, it's like a metaverse now. You want a regular treatment with pills and injection, or do you want to peptide, PRP and stem cells? It's a different word, and I think it's going to be growing. Last year, we were less than 100 in the conference. This year, we're more than 500 in the conference. I was shocked when I walked in.
I'm sure.
Yeah.
How can people get in touch with you to get your services? I heard you're
fully active on Instagram, Dr. Hany Demian, LinkedIn. I respond pretty fast, and my website, drdemian.com. I would love any answer. I would love challenging cases. If you have any questions about all this, what's legit, what's not legit, my advice is based on science and not really hype. I don't like the hype of things, so I take my time and look into it.
Okay. Well, Dr. Demian, thank you so much for coming on the podcast. I had a good time speaking with you. And again, thank you.
Likewise, I really appreciate it, Richard, and hopefully we'll meet again with new advancement.
If you like this podcast, please click the link in the description to subscribe and review us on iTunes.
Thank you for listening to the Good Question Podcast. Please email support@thegoodquestionpodcast.com if you have any referrals to great guests for us to interview. Visit thegoodquestionpodcast.com to hear more interviews. And please help us spread the word by rating and reviewing us on Apple Podcasts, iTunes, Spotify, YouTube, or wherever you listen to this podcast.